Hello everyone. Thank you for joining us for this presentation on nursing incivility. I'm Bethany, and Joanna has also helped me in this presentation. I will be sharing the first half and she'll be sharing the last half. This is for a research methods class here at Southern Adventist University School of Nursing. Incivility is a major problem in our world today, and especially among new residents, new nurses that are just beginning their careers. Some of the effects incivility has is job burnout, medical errors, and patient harm. In our world today, in the professional world of nursing, we need complete eradication of workplace incivility. Many studies have talked about prevention, but there is yet to be a study to completely eradicate nursing incivility. Our PICO question says this: will new resident nurses be retained each year when efforts to implement a code of conduct to reduce nursing incivility and promote a team-oriented environment provide better patient outcomes compared to a hostile work environment? Let's look at descriptions of studies, what each study out of the 6 studies bring to the topic of nursing incivility. In the first study, they used a mixed method research design, both of quantitative and qualitative data. It had to do with nurses' daily interactions with incivility, what they experienced. Those that were a part of the sample were RNs from 5 of the Sigma Theta Tau in Ohio. Some were male and some were female, ranging in ages from 22 to 69. This was an anonymous questionnaire that was used. That's how they collected the data on nurse relationships and the interactions they had throughout their day as they were at work. Then the data was analyzed qualitatively. The researchers individually thought about the results, and then they all came together to have a group discussion. Study 2, the model for improvement by Langley, was used. It was a qualitative study, and they were looking at how nurses could recognize incivility, if they were good at recognizing it. Those involved in this study were night shift nurses on the medical surgical floor of a Kentucky hospital. All of those were female, and they ranged in ages from 24 to 56. The questionnaire that they received was about 3 to 4 minutes long, looking at 2 different scales, one of workplace incivility and the other one was a confidence scale. How well they could recognize it and how well they could actually deal with incivility. Then descriptive analysis was used, the SPSS version 21, to effectively analyze the data for study 2. In study 3, they used a descriptive qualitative research design. In this study, the goal was to understand nurses' experience with incivility, what they saw on a daily basis. Those involved in this study were nurses from the educational hospital at the University of Medical Sciences in Tabriz, Iran. Both males and females were a part of this study, and they ranged from 25 to 52 in age. This study was different than all the rest in that they used personal interviews lasting from 35 to 65 minutes, where they personally interviewed each person and looked at their experiences with incivility. Then that data was also analyzed through qualitative content analysis approach, and they used the MSXODA software version 10 to analyze that data. Study 4, they used a cross-sectional network survey. They wanted nurses to do lots of self-reporting, just on their thoughts, on workplace incivility, what it meant to them. Those involved were Chinese RNs with 3 years of experience or less on their current work area. Snowball sampling was used to gather the data, and again, the questionnaires were anonymous. Then this data was analyzed through a descriptive statistical analysis, and this one looked at the percentages of workplace incivility or workplace violence in that particular hospital setting. Study 5 used a cross-sectional study in Iran, and they did random sampling. In this study, 3 educational hospitals were involved. The staff that worked there of the Mashhad University of Medical Sciences. All the participants completed a questionnaire, and it was based off of this perceived workplace civility scale. Then the data was analyzed using the SPSS version 11.5.
Study 6 was the quasi-experimental design in which it would alternate a month design and 5 study interventions. And the sample size was actually very large. It included anyone that was registered at the OED teaching hospital. And data collection was through 5 specific interventions, which included organizational, environmental, educational, human, and a security approach. And it was analyzed by the SAS/STAT software, which compared incivility rates before and after the intervention itself. So findings in our research highlighted the negative impact that nursing incivility has on nursing staff and the unit. More also highlighted how empowering nurses to resolve conflicts between one another is crucial to improving nurse relations. Prevention is also a big form of preventing these type of uncivil behaviors, and this is done by decreasing workload so nurses don't feel overwhelmed, stressed, and frustrated, and because sometimes they tend to take it out on their peers, on their coworkers. And also improving communication is a big form of preventing this type of uncivil behaviors. Also, even a low level of nursing civility should not and cannot be tolerated. And it is up to the nursing managers to reduce and prevent these behaviors. They're the ones that need to look out after their nursing staff. Application to practice focuses on a need for programs and training sessions that will promote a teamwork and healthy environment, because nursing civility does cause detrimental effects on the nurse, but unfortunately they tend to transfer over to the patients, which will cause harm to them by medical errors that could have been prevented in the first place. Nurses also need to feel encouraged, uplifted, and supported in their workplace in order to provide the best top quality care to their patients. Now, from a spiritual perspective, we know that Jesus is not in favor of incivility, or does he tolerate and support it. An example of this would be the story of David and Bathsheba. As we know, David placed Bathsheba's husband Uriah in the front lines when they went out to battle so that Uriah would be killed, and therefore he would marry Bathsheba. And because of this great sin, David lost a bunch of his sons, and this was a consequence for his uncivil actions, for his sin. And so if Jesus was present today, we believe that he would teach nurses how to be loving, kind, how to work well in a team. And of course, there would be no incivility in heaven. Some topics for further research were to determine whether training programs were actually beneficial in reducing workplace incivility, and also best practices for addressing and resolving poor nurse relationships, and examining the nurse manager role in creating work settings where positive relations can thrive. Nursing incivility continues to be an overwhelming problem in the nursing work environment. Nurses tend to feel anxious, depressed, physically ill. They tend to make up excuses so they don't come into work because they're afraid to be bullied and be treated unfairly. Our PICO question was supported by our research, however, it did not answer it in its entirety. And incivility was not a part of Jesus' plan for us. He wants us to be team oriented when it comes to our work environment and always be ministry minded. And finally, to conclude, eradication of incivility is the ultimate goal for positive patient outcomes and to nourish our nursing staff and nurse-to-nurse relationships. So these are our references that we use throughout our research. And finally, Bethany and I would like to thank you for listening to our presentation, and we really hope you enjoyed. Thank you.